Hey guys, welcome to day 15 of our March Madness practice questions. As always, I like to get into my introduction and disclaimer before starting our questions. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I design review courses, review material, and videos to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. But I always like to give the disclaimer before I get started and get into questions that we know there's no absolutes in medicine and we treat on a patient by patient basis. So when I design these things, if there are questions, they'll be on the current guidelines that are being tested on as they vary and change. But if I'm teaching you what we're doing currently in practice, I'll say that so there's no confusion in those areas because sometimes, they change the exams every 2 to 3 years. And each exam, meaning like the ANCC, the AANP, they vary when they do theirs. Like the AANP just released a new one. So with that, those guidelines are what they have been currently working on to design this. So if something just came out this year and we're doing this in practice, the exam doesn't say that. So I'm trying to get you prepared for what the test is going to test you on. All right. So let's get to question number one. All right. Question number one states a patient presents to the office with complaints of continued hair changes and it is brittle and moderate weight loss. Tachycardia is noted on exams. Labs completed and are as follows: the TSH is zero point 0.2, T3 is 232, and T4 is 13. Based on these findings, how should the nurse practitioner diagnose? Is it A, hypothyroidism, B, hyperthyroidism, C, hyperparathyroidism, or D, hypoparathyroidism? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first to slow yourselves down and ensure you're answering what is truly being asked of you. So the stem of the question states, based on these findings, how should the nurse practitioner diagnose? I say if they're asking you for a diagnosis, you need to take it back and look at how they present. What's the assessment, right? And if they're asking you how do you treat, you need to take it back and look at the assessment, the differential diagnoses. You have to know the process to get you where you're truly trying to answer. And like I always say, in the test, they're testing for those areas. So that's why I teach in those methods of assessment, diagnosis, evaluation, and treatment. But here, the presentation is the patient comes in complaining of hair changes. Her hair is brittle. She's having moderate weight loss. It's noted that she has tachycardia. Already with the presentation, you should start to be able to form certain differential diagnoses, and this should put you in the mind of thyroidism. And honestly, it should make you think of hyperthyroidism. And if you struggle with these, I have a video on it to explain uh, easier ways to look at the presentation of hypo versus hyper, and then getting into the lab work. But with hyper, I say think of someone hyper like they're running, running, running. So you're running, you're sweating, your hair is brittle from all of the excess sweat. Your heart rate is up because you're running this race, right? And because you're running, running, running all the time and you're hyperactive, you're losing weight. That is classic presentation for hyperthyroidism, whereas hypothyroidism is the opposite. Slow and slow, they're not really wanting to get up and do anything. They're starting to have weight gain. Their heart rate is slower. So it's the opposite. But when they're looking at these lab values, you need to be able to confirm that differential diagnosis that you are considering based off of their presentation. So the TSH is zero point 0.2. The T3 is 232 and the T4 is 13. But with this, you can see that the TSH is low and the T3 and T4 are elevated. So this is your confirmation. So when you're going through your lab values and you're considering, I always say the TSH is going to be opposite from what the term means, and the T3 and T4 will coincide with the term. So what do I mean by that? If we're thinking is hyperthyroidism, hyper meaning excess, elevated, right? The TSH is going to be low, opposite, right? but the T3 and T4 will coincide with the terminology. So it's elevated. And then vice versa for hypothyroidism. But go check out that video. I'll link it in the description if you need further review on hypothyroidism versus hyperthyroidism. But the answer is B, hyperthyroidism. All right. Let's get into question number two. Question number two states a patient presents to the office for follow up. The patient has been diagnosed with H. pylori, and the nurse practitioner is discussing first line regimens for treatment. Which is the correct regimen? Is it A, omeprazole, clarithromycin, and amoxicillin? Is it B, omeprazole, bismuth, and amoxicillin? Is it C, omeprazole, uh, I'm supposed to say Pepto-Bismol because I always mess up that word, doxycycline and flagyl, or D, famotidine, clarithromycin, and amoxicillin? Take a moment and tell me what you think in the comments. In the comments. All right, stem of the question is, which is the correct regimen? We're talking about treatment here, so we need to know what the diagnosis is. They already provided it, letting us know that the patient has been diagnosed with H. pylori. So understanding the first line treatment for this. So first line treatment for it, I always say Prevpack. That's how I always learned it. The Prevpack always came with like the Prevacid or other PPIs along with the antibiotics, right? And so it's still the same. You're going to have a PPI, and then you're going to have two antibiotics. And they always do two antibiotics to decrease the risk of resistance from one of the antibiotics. So this will limit it because we have two different ones working against this bacterial infection. So first line therapy, and I know that with H. pylori there are multiple regimens, and I'll go over that really briefly. But there's multiple regimens, but the first line therapy. Look at that key statement in the question. It's asking for first line regimens. The first line therapy for H. pylori is a PPI. It's that triple therapy because they have triple therapy, the quadrotherapy, like the quadruple therapy, and then the concomitant therapy. So with triple therapy, that's your PPI and your two antibiotics, typically that clarithromycin and your amoxicillin, right? So here your answer choice is A. Now that quadruple therapy, we typically do that if there is a history of resistance to like macrolides, or if the patient may have a penicillin allergy. Then you'll go with that quadruple therapy route, and that's the bismuth, the Pepto Bismol. You'll have your PPI, but instead of using the penicillin and macrolide, you'll use a tetracycline and like the nidazoles, like your flagyl, like your metronidazoles, and things of that nature. So that's when you would utilize that quadruple therapy. And then concomitant therapy is really just a little bit of everything together, and it's a good choice. But the main issue with this is the adherence, because the patients are already taking multiple medications. They're already having GI upset. These antibiotics are going to give you, they have the history of giving more GI upset, and then we're putting so many into your GI system. When you do the concomitant therapy with the PPIs, the clarithromycin, the amoxicillin, and the nidazoles, like your metronidazoles, your flagyls, for that 10 to 14 day span, that's like beating up the patient's GI system. So first line therapy is the triple therapy, Prevpack, your PPI, your clarithromycin, and your amoxicillin, unless they have any allergies or resistance. All right. And then lastly, let's get into question number 3 for today. A patient has been started on Fosamax for the management of recent diagnosis of osteoporosis. What education should the nurse practitioner provide to the patient when taking this medication? Is it A, take at bedtime, B, take on an empty stomach and do not lie down, C, take on an empty stomach and drink with orange juice, or D, take every other day? Take a moment and tell me what you got. All right, read the stem of the question first. The stem of the question says, which education should the nurse practitioner provide to the patient when taking this medication? So, what medication? We're taking Fosamax. Make sure you know medications and their drug classes so that if you are stuck, you can go based off what you know for the class itself. So, Fosamax, also known as alendronate, ALENDRONAT, and remembering that this is a bisphosphonate. So with those bisphosphonate meds, you should know quickly B is your answer. You want them to take it on an empty stomach. Tell them to drink a full glass of water and not to lie down. Typically, the instructions when you give it to them is to take it first thing in the morning, go for a walk for 30 minutes, and then proceed with your day. And this is so that you're ensuring that this patient is not lying flat. You're ensuring that they're not putting anything else additional on their stomach because this can cause erosive esophagitis. That's the reason why we don't want you lying flat. That's the reason why you want to consume a full glass of water afterwards to help flush this down. And then you want it on an empty stomach. Now, so definitely you can rule out taking at bedtime. Yes, you want to take with a full glass, but in some medications, you know, the vitamin C will tell you to drink with orange juice, but this is not one of them. And then you need to take it daily based off of how it's prescribed. So just remembering the treatments and the importance of that when you are prescribing bisphosphonates. All right, you guys, as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial. If you need any more of our services, our online review courses, we offer self-paced courses. We also have group review courses that there's one up and coming of our 5-week course. It'll be in the description or check the link that has been provided already. Or if you need a one-on-one session, we do this in various options where you can have it from 30 minutes to 120 minutes. Typically, we try to stick with the 30-minute to 60-minute increments over a scheduled plan. Sometimes people do it to just hone in on their weaknesses to make them their strengths, or some people want to run through practice questions together, and then other people are preparing for boards and they just want to do a quick run through of all the systems to ensure that they are prepared for boards. But our most common of our one-on-one sessions is the custom package where based off of how you have previously done on exams or where you are telling me you are struggling, we gauge that and design a plan, a study plan, and work through. And you are provided assignments, and we meet with one-on-one sessions based on your projected timeline for testing. But if you're interested in any of these, reach out to the Nursing Studio at 803-400-6864 or shoot us an email at the nursing studio, the number one, at gmail.com. Happy studying. Bye, y'all.